As COVID-19 cases continue to surge in our community due to the Delta variant, we want to address how to reduce your risk, what to do if you are exposed, and talk about the concerns that deal with children and COVID and more. So joining us today for To Your Wellbeing is Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snider. Let's first and foremost just start off with a review of the numbers. How have the numbers increased in the past few weeks at Cone Health, starting with the hospitalizations?
So over the last 2 weeks, we've had a steady increase, and we are about 150, 160 hospitalized patients. And again, the majority, I would say a 9-to-1 type of ratio of unvaccinated versus vaccinated hospitalizations.
All right. And so the next thing with the numbers that we're just kind of going down, ching, 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 ching of all of the, highlights is what about those COVID positive tests?
Sure. So we also, like the state health department and Guilford County, we look at the percent positivity. And that tells us not only how many people in our community are positive, but also understanding why they're getting tested. If there are too many people that are saying, I'm getting tested because I have symptoms, we need to definitely test more people, because we know that there's probably up to 20% of people that are asymptomatic or pre-symptomatic, where they just came in close contact or their family member is positive and they themselves need to go get tested in order to find out if they too are infected with COVID-19. And so our positive percentage rates are about 11 to 13% on a given day, which is roughly the same. That's what's going on from the state perspective as well.
All right, and you talked about the 9-to-1 ratio for unvaccinated for hospitalizations. Are the cases higher in unvaccinated individuals as well?
No, so yes, so that grouping, I would say about 90% of all our COVID hospitalizations are unvaccinated individuals.
Right, but I guess what my clarifying question was, and maybe I didn't state it correctly, I'm sorry about that, is the people who are testing positive for COVID now, are they mostly unvaccinated?
Oh, sorry, correct. So we are still seeing some breakthrough cases, so folks who have been fully immunized and have subsequently become infected, but that number is much smaller than our total. And I would say it's hard to predict what that breakthrough is, because it depends on different populations, but sometimes we've seen it as high as 20%. And again, the folks that have had breakthrough cases, they are not nearly as symptomatic as others, right? A lot of folks, especially within healthcare, we know we ask people to check their symptoms every day, probably the same as kids going to school or if you go to your workplace. And then if some people may start noticing having allergies or maybe a little bit of a cold, and it turns out that that's actually how the Delta variant presents itself in folks who are vaccinated.
Okay, so how concerning is the risk of exposure given that the Delta variant is that much more contagious?
So that again tells us, especially in a strain that's this contagious, we need to use all the tools we have, and masking plays a very big role, especially in folks where we don't have as much vaccine uptake. So it's exceptionally important in schools, when you go to church, when people are having gatherings, we need everybody to be masked, even if you're vaccinated.
All right, with more and more people testing positive, what should you do if you are exposed to someone with COVID?
We recommend to get tested as soon as you find out. Usually people are starting to have symptoms anywhere between day 3, day 5 after exposure. And that's a shorter window than what the wild type last year's strain usually started having symptoms between day 5 and day 7. So we definitely recommend, if you've been exposed, please get tested. And also it's especially important to stay quarantined, to not go in public until you've had testing. And also remember, you could shorten your quarantine period if you get tested closer to day 7. And if that's negative, then by the local health department rules, you may be able to get out of quarantine.
All right, and that is a much shorter time span than it was the first time around as well.
Correct. I think it really depends. Also, you have to check on your workplace. Some place and schools. So schools may still require folks to do a longer quarantine period of anywhere of 10 to 14 days, but testing allows people to get out of that quarantine jail a little bit earlier.
Okay, and you said around day 7 or so.
Correct.
Okay. All right, with kids returning to school, many parents, of course, are concerned about the exposure to kids with COVID. What are the do's and don'ts of protecting kids from COVID?
So I don't think masking is optional in any setting for schools. It has to be mandatory. That is the safest way that we can keep our kids in school. And even most recently, there was a report of how an outbreak happened in a classroom where the teacher nor the children wore masks, and over half the kids got COVID. So I think masking is exceptionally important. Anybody who's 12 and older, we really need them to get vaccinated. And in fact, they've had many sporting clubs or sporting teams who are now requiring kids to be vaccinated so that they could be the safest while they engage in different tournaments.
All right, so the majority of new COVID-19 cases and hospitalizations are unvaccinated folks. However, there are some breakthrough cases. We kind of touched on that a little bit. Is there a difference in the symptoms and also the severity in the breakthrough cases versus those who are not vaccinated?
That's a great question. So I would say in terms of presenting symptoms, there's probably not that much difference. A lot of people mentioned they kind of feel like they have a cold. They're a little bit under the weather. There's a little bit less loss of smell and taste. And then, but severity this is where the vaccine works. By far, we have so much fewer people who are hospitalized that have been vaccinated. And again, far fewer people who are in the ICU becoming intubated and deaths. It still really is the deaths that we're seeing right now is all in the unvaccinated folks, and it's heartbreaking. I think the story that you mentioned earlier with how overburdened and fatigued our healthcare teams are is a reality, and COVID, like severe disease, is preventable. Deaths from COVID are preventable, and we need everybody to get that vaccine.
I understand. I hear the fatigue coming out of your voice. Because you're overseeing all of those people who are doing that and seeing that on a daily basis.
Yes, I think, a lot of people may have felt that they had a vacation this summer, but on the healthcare side, nothing let up. And so a lot of our nurses, our nurse techs, even I think every aspect of folks who work in hospitals, they are feeling the brunt of trying to have enough energy to continue to work as hard as they have this past year.
Mm-hmm. So final thoughts then on the Delta variant and how to decrease the spread to turn these numbers around to give some relief for all of those healthcare workers.
So that's the key thing. I think everybody needs to really believe that we're all in the same boat, the same storm. We need everybody to put aside their ideologic differences. I don't really care who you vote for, what church you go to, if you like the color green or not. I need everybody to get the vaccine. Our health systems, not just mine, our surrounding health systems, everybody is overwhelmed. A lot of elective surgeries have been postponed. I think some care has been delayed, and this is because we are overwhelmed with COVID cases. We are doing as much as we can to provide the great care we can and making sure people are treated accordingly, and we are getting, we're getting people who test positive access to monoclonal antibodies so that they don't get hospitalized. We're doing increasing testing in our community. We're doing more vaccines in our community. But we really do need everybody on board. We need everybody to help us. If you are eligible to get the vaccine, please ask your provider any questions you have, but we need you to get that shot in the arm, and it's not too late.